chronic obstructive pulmonary disease or COPD is the 7th leading cause of death in Singapore, making up to 2.5% of deaths. COPD ranks 7th in the top 10 conditions requiring hospitalization, with nearly 10,000 episodes of it in a year. Because of the slow progression of COPD, the disease is likely to be underdiagnosed in the community and is more prevalent in the elderly and the lower socioeconomic class. We can prevent this. JurongHealth's integrated care pathway for COPD is the first in Singapore to integrate the spectrum of services for patients across multiple sites such as polyclinics, general practitioner GP clinics, home hospice care, medical center, community hospital, and acute hospital. The program bridges and connects services in the healthcare ecosystem to meet the needs of the patients and their caregivers. Working on this healthcare model, this integrated care pathway can be applied for other conditions like hip fractures and stroke. COPD patients will benefit from a coordinated and multidisciplinary approach to the management of their medical condition under JurongHealth's Integrated Care Pathway COPD program. Dedicated coordinators, together with JurongHealth's multidisciplinary team of doctors, nurses, respiratory technologists, pharmacists, physiotherapists, and medical social workers will develop a customized care plan for each individual patient, empower patients towards self-management through education, monitor patients' disease progression, help coordinate referrals and patients' appointments across care sites. We will implement 5 standards of care: prevention of COPD, early diagnosis, management of stable COPD patients, treatment and support during acute exacerbations, care and support at end of life. Our integrated care pathway for COPD program identifies the current problems in managing the disease and provides solutions to plug the gaps. Early diagnosis and intervention efforts for at-risk individuals in the community are currently inadequate. GP clinics do not have spirometry services. This program empowers primary care providers such as GPs and polyclinic partners to provide education and identify at-risk patients, especially those who are smoking. Public screening events will help identify at-risk patients for early intervention efforts. Primary care partners can refer these at-risk individuals for spirometry services at JurongHealth. This service is available at Jurong Medical Center and Alexandra Hospital. Many smokers continue to smoke, and these patients are not referred for smoking cessation. Smoking cessation counseling services at Jurong Medical Center and Alexandra Hospital will be provided to smokers who are referred via the program. COPD patients in the community have poor quality of life and functional status. Pulmonary rehabilitation is not conveniently available. The capacity and capability of pulmonary rehabilitation services at Jurong Medical Center and Alexandra Hospital will be geared up. Care for COPD patients can be fragmented and uncoordinated. There is no active tracking and monitoring of the care plan for these patients. With this program, there is active case management to enhance communication and coordination with the community healthcare partners to provide seamless, integrated care for patients. Many at-risk or COPD patients are not aware about the disease and do not know how to recognize the signs and symptoms. Patient education in this area is limited. Our integrated care nurse will provide patient education actively to patients in this program and reach out to the community to educate them about COPD. There remains a gap at the primary care level, and the needs of stable COPD patients and those at risk are underserved. There is a need to scale up services in areas of prevention and primary care management to close this current service gap to provide comprehensive integrated care along the care continuum. The treatment of COPD patients involves partners from primary, acute, and step-down care sectors working together. Navigating across and within these sectors needs to be coordinated, and with this program, there is active case management to ensure that the patient is provided the right care at the right place at the right time. By working closely with patients on the COPD program, JurongHealth hopes to improve the life expectancy of our COPD patients and at the same time, improve their quality of life.